Hi, I'm Dr. Steve Petrou with the Department of Urology here at Mayo Clinic. You're watching this video means you've had an operation for your bladder control problems and basically you don't think it works. When surgeries don't work, sometimes doctors and patients have different opinions. Your doctor feels as if you don't leak, the operation was a success. But if you're going to the bathroom more than you did before, if you're still leaking with coughing and sneezing, if you're getting up at night, you're having pain, you feel the operation wasn't what you thought it would be. And the big question you have to ask yourself is, what do I do now? Well, there's a lot of different things you should do or you should consider. You should ask yourself, is this a problem for me and do I want to pursue it? Odds are you should pursue it. You're leaking urine, you're vital, you're accessing the internet, which means you want to get the most out of life. Here at Mayo Clinic, we specialize in seeing patients who had operations that just didn't meet expectations. If you come to Mayo Clinic, you should count on getting a good history obtained and a good physical exam. And then we'll go over and see what kind of surgery you had. The big question is going to be, did you have mesh or not? A lot of patients who had mesh have had problems. I'm sure you've watched on TV and seen commercials that testify the same. Here at Mayo Clinic Department of Urology, we tend to view mesh surgeries as good initial surgeries, but on repeat surgeries, a lot of times we use your own tissue called fascia. What is fascia? Fascia is the lining of a muscle, and I'll cut out a piece of the fascia just like cutting out a piece out of a tablecloth. And then I sew up the harvest site, and then we use that to rebuild your bladder neck. Does it sound like a bigger operation? Count on it, it is. But the nice thing about fascia, it's your own tissue. We don't put another piece of mesh in where mesh failed before. Now that's not saying that's not a good option, it's a very good option, and one that your doctor at home may offer you. Here at Mayo Clinic, though, we tend to utilize fascia and your own natural tissues even more. Recovery will be stated to you because it's so individualized, but count on getting a history obtained, a physical examination, and options offered to you. If this sounds like something you're interested in, contact us at mayoclinic.org. My scheduling nurse, Abby, will be looking for your phone call.